afternoon, everybody. Thank you for joining us a little bit later this afternoon. We have three panelists with us today: Dr. John Fox, Jobeth Mills, BSN, and Rachel Smith, BSN. Rachel is our Director of Nursing on the hospital side here at Lincoln Health, and Jobeth is the Director of Lincoln County Public Health. We are going to talk to you today a little bit about this next phase that the governor has set out that's entitled Protect Our Neighbors. It is an application, it doesn't just happen. And so we'll talk to Jobeth a little bit about that. Dr. Fox has a little bit of information about oxygen levels while wearing a mask, and we'll of course, as usual, answer your questions. So thanks for joining us, and we'll go ahead and get on with our Q&A. Jobeth, try to talk a little bit about, not to put it poorly, but the hoops you have to jump through to complete the application for Protect Our Neighbors.
Yeah, so there's an extensive list of points we have to prove as a county that we can be able to meet before we can apply for Protect Our County. And it's not just something between the commissioners and public health, it's the hospital, it's the mayors, it's the emergency manager, commissioners, and public health. So all these people have to have a buy-in for the county, and then we go over the plan on what we can do, and if we can meet those measures, and then also based on our numbers as a county, and our testing capacity, and our contact and tracing on what we can manage as a community, what our hospital can manage. There's just a lot of things that play into that. Part of the Protect Our Neighbor is increasing our mask wearing by 50% as a county. So that's something that is encouraged. Well, it's not encouraged, it's part of the Protect Our Neighbor metric, so it's something that we have to be able to prove. I'm trying to think if there's anything else. I mean, that's pretty much in a nutshell.
Right. And that includes, so you're having to have meetings with all of these entities that you're listing to make sure that we can meet those guidelines. Okay. All right, we'll move on to Dr. Fox. You want to tell us what the information you're going to share with us about proper mask wearing and how it really affects the oxygen that you're taking in?
So you're seeing and hearing and reading all sorts of things about how dangerous it is to wear a mask. And so I just want to, I'm going to slide back away from everyone. So I'm at the appropriate social distance, because I'm going to take my mask off for just a second here. That's 6 feet? Yeah. I'm going to take my mask off. I have a little device I'm putting on my finger. It's called a pulse oximeter, and it measures the oxygen level in our bloodstream. I guess I got to have a pulse first. So just sitting here breathing normal room air, my oxygen level is I was doing better with the mask on. So just sitting here breathing room air, my oxygen level is sitting right at 98%. What I'm going to do is put my mask back on, and we'll check back in a little bit later and see where my oxygen level is, since I am wearing a mask now. There's been a fair amount of research that has gone into mask wearing, and you've heard how far droplets travel if someone doesn't have a mask on. If you cough and you don't have a mask, basically within the first 5 seconds, it's traveled 6 feet. With a mask on, there's obviously a lot less droplets that get out, and those droplets travel an average of less than 10 inches. So that makes it obviously a lot safer. And again, the program that we're looking to enter into is called Protect Your Neighbor. And just remember that that's why you wear a mask. Yes, there is a little bit of protection that you're going to get for yourself by wearing a mask, but the reason we're doing this is we're going to try not to give coronavirus to our neighbor. You say, well, but I'm not sick. There are various estimates, anywhere from 20% all the way up to 70, 80% of people that have coronavirus have no symptoms. So basically, you can't tell me that you don't have coronavirus just because you don't have symptoms. So the concept of wearing a mask is to protect your neighbor, to protect each other. And it's something that I would hope we would want to be doing for our fellow human being here. The other thing it does is it allows us to keep the county open. It allows us to continue our retail businesses, and maybe even increase some of that's going on. So even with the mask on and with me talking, using up all my oxygen, my pulse oximetry is still 98%. So the mask has absolutely no effect. So at any rate, it is safe to wear a mask. There's no question about that. Some people think it's uncomfortable. I wouldn't argue that. My face gets a little sweaty when I have a mask on all day. But it's worth it to protect other people.
Perfect. Thank you, Dr. Fox. We do have a question. Jackie asked, says 6 days away from the last date you gave for patio visit. What do you have for us on that today? Jackie, I probably should have asked Erica Sapper to join us today. She's the nursing home administrator here at Lincoln Health. She and the interim director of nursing in the care center do have a plan in place. They will be announcing that on July 16th. So we're about 7 days away from that, and we will announce the visitor policy on Facebook Live. We'll post those guidelines online. They'll be listed on the doors of the care center. Visiting hours will be Mondays through Fridays, so just through the week and nothing on the weekend. But we'd really like to lay that plan out in detail for you next Thursday. It will begin the week after, so that will be Thursday, Friday, so that following Monday, those visits will begin. And that is, again, dependent upon making sure that we don't have any community outbreaks within Lincoln County. We really want our residents to be able to see family members and friends, but we also want to make sure that that's definitely safe for them before we proceed. How many tests have we done so far at this point, Jobeth? We'll do an approximate.
It was a 218 last week, so we are probably at like 230, 240.
Okay, great. And
Jobeth, one of the questions that comes up is, as we progress to open things up more and more, we know that if we get an outbreak in Lincoln County, we keep saying that we're going to have to go back and kind of go back to start all over. How many patients would that be for Lincoln County?
So right now, so the way that the state defined this last variance is we have to have, so if we get two cases that are not linked within the same, like if one person gave it to another, they call it epilink. So if one person or so if there's a household that has, there's a couple people in the household that has coronavirus, and then there's another one over here, that would be our 2 cases, and if we get those 2 cases, then we go on probation. And then we have 2 weeks from that point that if we get 2 more separate households, for example, that would be where our variance gets pulled.
So it wouldn't take a lot.
So not linked to each other?
Yeah, so not epi-linked is what they call
Okay.
it.
Good to know. We don't know
So
which
our
one.
previous variance stated it was 5 cases in a week, and these are 2 cases within 2 weeks.
2 cases.
So 2 separate households within 2 weeks.
Okay, I gotcha.
Yeah.
I am asking for you, Jackie. I will let you know within the next minute or 2 here if that out-of-county visitors will be allowed. I believe so, but I don't want to speak out of turn, so I'll let you know.
Just some statistics from this last week, that in the United States there have been 368,000 new cases of coronavirus just within the last week, and that actually is 27% of all the new cases worldwide. So I guess the United States is leading the world in something right now, not necessarily what we want to be leading the world in. Colorado has seen an increase in the number of cases each day over the last 5 days. It's not a lot of cases, I admit that, but the fact that it's heading up a little bit is concerning. It's interesting that right now the transmission rate in Colorado sits at 1, which means for every person that has it, they only give it to one other person, and that allows us to stay level in terms of the numbers of people here in the state. The worst state is actually Nevada. They've got a transmission rate of 1.56. But interestingly enough, the best state in terms of transmission rate in this country right now is Massachusetts. Theirs is 0.81%. They've got this little town in Massachusetts called Boston, so the fact that they are able to see decreasing numbers in spite of having that large community within their state is pretty remarkable. They did, one of the interesting things they did, I know you guys get tired of hearing about masks, but they actually passed a mandatory mask law on May 1st of this year. Now, does that mean everyone in Massachusetts is wearing masks? No, but it means a higher percentage of their population are wearing masks, and that is one of the key reasons that their transmission rate is the lowest in the nation right now. So, I would love to see us wear masks voluntarily and not necessarily have to have a mandatory law, but I'm all about anything we can do to slow down the spread of this disease. If we see a significant outbreak in Lincoln County, we could see as many as 1,700 of our patients hospitalized. We could see as many as 292 deaths in this county from this disease, and that's based on Colorado statistics. So please stay vigilant. Please wear your masks. Wash your hands, and stay a safe distance from others.
So we just shared to our Facebook page today some tips for visiting with high-risk loved ones and family members. It's really just the basic stuff we've been drilling over and over. There's 5 bullet points: wear a cotton mask or a fabric mask, stay 6 feet away from high-risk individuals, meet outside if possible, wash your hands often and use hand sanitizer, sanitize all touch surfaces. So they're all pretty basic, pretty simple ways to make sure that those individuals that we love that are of the high-risk population stay safe. But there's a little video on our Facebook page if you'd like to check that out. Dr. Fox, did you have anything else you wanted to talk about?
In reference to Jackie's question, certainly if someone's coming from a high risk area, it is entirely possible that we're going to ask them to come to Lincoln County and isolate themselves, quarantine themselves in Lincoln County for a couple of weeks before we allow contact. Someone that's coming from a real low risk spot, that screening may look different for that person. So just be aware that you know that's part of the decision making process, and the whole goal is to minimize risk. We absolutely, you know, we've been able to keep it out of all of our assisted living and long-term care facilities for this length of time. We would really like that to continue. Yeah, just be aware that there may be, depending on where you're coming from, and the best thing to do is once we start, call ahead and say, hey, I want to come visit. Here's, you know, you'll get asked a bunch of questions, and we can make it as safe as possible for everyone involved.
Absolutely. Just the nature of our care centers make it impossible for us to keep the residents themselves quarantined or really social distance quite as much as you would be able to in a different setting. So that's part of the reason for the extreme caution. Doesn't look like we have any further questions. Let me double check. We may just be done early today.
One of the things that there's a couple of things I'll mention while you're looking there. You know, some people will go out, they'll get tested, they'll get their test back, it's negative, and so they'll take their mask off and they'll go out to the store or out to eat or whatever, and I just want to remind you that's kind of like getting tested for a sexually transmitted disease, tested negative, and then go out and have unprotected intercourse. You know, if you test negative, that's great. Put the mask on and keep it that way. One of the thoughts I want to leave everyone with today is, and this came from one of my patients, you know, we'll never know if we did too much. We'll only know if we did too little. I'd much rather do too much, and like I said, we can talk about it years down the road about, you know, did we really have to do that? But I guarantee if we don't do enough, we're going to be, well, some of us might be talking about it years down the road. Some of us probably aren't going to be there to talk about it. So please do your part. Keep your neighbors safe by wearing your mask when you're out in public. It also does help to protect you some as well.
Perfect. Jobeth, do you have any preferred methods of contact if people have questions specifically for you?
So there's some information on our Facebook page, so they can contact us. There's a couple different places they've put an email address they can reach. Also, they can call.
Okay.
There's really no, however they feel comfortable.
Okay, great. And just to remind everyone, this Protect Our Neighbors stage is really aimed at giving control over these health ordinances back to the community at the community level. But we have to make sure that we're doing that in a safe manner. So know that Jobeth is working on that for us right now. We'll post that contact information here in the comments. And, I just completely ignored you today, Rachel. I'm sorry. Did you have anything you wanted to talk about? All right. Well, everybody have a great Thursday afternoon, and we'll catch back up with you next Thursday. Have a good one.